On this episode of the ASC Podcast with John Goehle, we discuss the latest news in the ASC industry, provide an update on healthcare data breaches, discuss methods to create and update your policy manual, and in our focus segment, we discuss revenue cycle metrics with Jessica Nelson from Surgical Information Systems.
This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, SIS. SIS's mission is to deliver solutions and services that help surgery providers, regardless of care setting, improve their organization so they can deliver the highest level of care to their patients. For more information, go to sisfirst.com.
Welcome to episode 227 of the ASC Podcast with John Goehle for August 18th, 2024, recording from our studios in Spencerport, New York. This is Sue Cronkite, co-host of the ASC Podcast with John Goehle and Operations Manager for Ambulatory Healthcare Strategies. We would like to remind our listeners that the ASC regulatory environment is a rapidly evolving landscape, and the material presented in this episode is based on the most current information that is available as of the date of recording. As such, it is important to recognize that this information may be subject to change, and we advise all ASCs to stay up to date with the latest regulations and guidelines issued by their relevant regulatory bodies. Joining me today is John Goehle, the owner of Ambulatory Healthcare Strategies and one of the most respected experts in the ambulatory surgery industry. With over 30 years of experience, Mr. Goehle has authored over 10 books on the ASC industry, and he is a sought-after speaker on regulatory accreditation and finance issues.
So we hope all of our listeners are having a good summer. We certainly are enjoying it, though I hear other parts of the country are not getting as much rain as we are. So
yes.
we would gladly ship it off to you if you're a little bit dry out there. It has been a busy summer. We've been having a lot of surveys of our clients over at Ambulatory Healthcare Strategies, and both Lori Rodricks and I have been doing quite a number of surveys on behalf of AAHC. So, and speaking of that, I'm actually heading off, Sue, after we finish recording today to head down to do a survey Monday and Tuesday. You know, I'm starting to get used to the new accreditation management system from AAHC. I'm actually enjoying it. It's a steep learning curve, especially since I've been doing surveys for about 20 years now. And I remember when I first started, we did everything on paper. And then we went to Excel spreadsheets, and then we went to a program, and then we went to this new program, and it's come a long way. So somebody old like me, it's a little bit of a challenge. But what I really like about it, it's a much more powerful program, and I think it will help reduce the time after the survey is over in getting the reports to AAHC and to the center. As a matter of fact, that has happened with me already, and even faster as I do more and more surveys. And then later on this week, I'm heading off to Chicago for their annual conference, for the Illinois Association's annual conference, and I'm excited to be doing a administrator's workshop. I do this periodically in some of the states, and certainly if you're a state association looking to include this in your annual conference, I'd be glad to work with you on that. But anyway, Illinois has got a 4-hour administrator's workshop. I think it's on Friday. Sue, this has become a very popular thing right now. Administrator and director of nursing leadership training has become a major thrust in our industry. And you and I have talked about this quite a bit, that, it really is challenging to find experienced leaders out there.
Yeah. Hard to find good training. I mean,
that's right.
We know of some, but
yeah, that's right. Our boot camps are booming. We have over 300 graduates already, and we have 2 more boot camps scheduled. So if you're interested, our director of nursing boot camp is October 22nd to the 25th, 2024. For the live portion. And The administrator boot camp is going to be January 28th through the 31st, 2025, again, for the live portion. All of our boot camps include access to our patron program, ongoing mentoring, including our pretty well-known now weekly drop-in sessions, almost every week drop-in sessions, where you get an opportunity to sit down and talk to, the hosts of the podcast and other patron members.
And of course, when we say live, it's live virtual.
Virtual, correct.
But you're able to ask questions, and
it's been quite we do things very differently. I think ours, we don't pretend to be super polished with regard to our boot camps because we really want to have that spontaneity that comes from people asking questions throughout and from multiple voices, multiple people presenting during these sessions. So, and if you can't wait for our live virtual conferences, we do have on-demand versions of all of our boot camps. And again, all of the live versions and the on-demand versions are available at ASC-Central.com. That's ASC-Central.com. And we also did announce our 2024 Multi-State Virtual Conference, which is going to be November 14th through the 15th, 2024. And like our conference last year, this is a great opportunity to get 2 full days of valuable insights from some of the nation's leading ASC experts in the areas of infection control, life safety, human resources, finance, survey preparedness, and much, much more. And if you are a CASC or CAPE certificant, the program offers 16 AEUs and 4 IPCHs, and you don't have to leave your office. Or some people actually take those days off and work from their home so they don't get interrupted. It's a great opportunity to get this training without the expenses of travel.
And with that, you'll be able to ask questions also. And when I say ask questions, and why we say live, even though it's virtual live, you can ask questions, in real time. You can just type in a question and we'll ask the speaker. I know a lot of webinar type things, you can type questions in and they're asked at the end. But I think that's difficult because I know with me, if I get stuck on something that I don't understand or I really want to know more about, it's kind of hard to move on to the next step without, and feel like I'm still following. So that I think that's so useful. And sometimes it brings us in a direction that we didn't even realize, the people needed to know about. So it's really helpful that way to have it that real-time interaction.
Yeah, and I think to that point, some of the training recently, I think we've kind of moved away from a lot of these live virtual conferences. We still continue to do it. And, of course, we do have the on-demand versions, too. But that live interaction is so important, as you said, Sue, to be able to make sure that you have an opportunity to make it totally relevant to you. Here's the best news about our multi-state conference, though, is that it is totally free for members of our ASC Podcast with John Goehle patron program, as well as members of the following state associations. So that's one of the reasons we call it the multi-state conference, is that if you're a member of the following state associations, you get it for free. And that's the New York Association, Massachusetts, Virginia, Texas, Pennsylvania, Oregon, and Colorado. And we do expect a few more states to join up. If you are a leader of one of the state associations, please email us at info@ascpodcast.com to sign up today. It is free for your state association, so it is advertiser supported, of course, but it is totally free to the state association, and you can make it free to your members. Speaking of the patron program, we did experiment this last week with moving our weekly drop-in session from Saturdays to 3 p.m. on Fridays. Now, we've done this before, and again, this is all Eastern Daylight Time. We did try this last year. We tend to do it during the summertime when people really want those weekends for fun. But interestingly, Sue, isn't it interesting? We had the same number of people that we usually get, but they were very different people than normal. So we are going to keep, experimenting with some other days of the week.
And it all depends, because sometimes it's hard to pin you down, John.
That's right. This week it's not going to happen.
On what's happening.
The patron program is a great way to keep up with podcast hosts and other experienced ASC experts on a weekly basis. And I should say that's generally. It's not always every week. If holidays are in there, or if I'm traveling too much, I might not be able to do it. And we at Ambulatory Healthcare Strategies are very excited because our semi-annual retreat is coming up in a week and a half, I think. We do it twice a year. It's a way for us to get together to discuss ASC issues and ambulatory health, all of our employees from ambulatory healthcare strategies to get together and talk about ASC issues and what's going on in the company. We are a virtual company, which means that not most of our people really don't get together or aren't even in the same room, quite a bit of the time. Even though we have like weekly, virtual meetings, it's not the same as getting everybody together for a nice retreat where we can sit down and talk things around a table. And in particular, we're going to be discussing some ongoing changes to our QAPI and our governing body templates. That's something that seems to be a work in progress. And then also, if you haven't heard this already, we are implementing a financial services oversight program within the next year at Ambulatory Healthcare Strategies. So if you're looking for some financial services, in particular reporting and development of financial feasibility studies as well as financial projections, please reach out to us at AHS. And Sue, I was, and when we were getting prepared for all the news, I was checking the CMS website again, and I really was kind of surprised that there are no quality, safety, and oversight memorandums from CMS. Knock on wood, of course, when they do come out, they do tend to be issues that we have to address pretty quickly. But it's been pretty quiet, and I don't expect to see anything really before the end of the year, but we will keep an eye on that for you. So let's talk about some recent news. Go ahead.
So a lot of the news that I saw recently had to do with HIPAA and cybersecurity and breaches. So you're going to notice a little trend here. But to start it off, a quote from the HIPAA Journal. In 2023, 133 million health records were exposed, stolen, or otherwise impermissibly disclosed, dwarfing the 51.9 million records breached the previous year. So that's a huge increase.
A lot, yeah.
The 2023 total included 26 data breaches of more than 1 million records and 4 breaches of more than 8 million records. The largest data breach of the year affected 11,270,000 individuals, the second largest healthcare data breach of all time. So that kind of establishes why we need to, be concerned about this.
Well, and indeed, we've seen it even among our 87 clients over at Ambulatory Healthcare Strategies. Another breach did occur earlier in the year with the organization. Luckily, they didn't really get any health records, but they did get into the system and cause some problems for their computers.
Then there was an article in Axios written by Tina Reed. This was from July 8th. Discussed the implications of the proposed rule for faster reporting of cyber attacks. So the Cyber Incident Reporting for Critical Infrastructure Act of 2022 called for companies and organizations to report cyber attacks within 72 hours and ransoms paid within 24 hours, and included information on what is considered a substantial incident, how to report, and the ramifications of not reporting. So the reason for the proposed rule is to be able to spot incidents or trends more quickly and allow them to warn other companies and hopefully be able to reduce the attacks or at least kind of reduce the damage that they can cause. Healthcare practices are concerned that it would be difficult to provide all the information in a timely manner and might overburden the staff while they're also trying to deal with the ramifications of the attack itself. They also worried that they would be providing the information that could be used by bad actors if the information was discovered. Because I think it's a real detailed bunch of information you have to provide about your protections and all of that, which, if it goes to the right place, that's fine, but they just worry about getting all that information in one place, plus the fact, they're dealing with a lot right then. So there's also a lot of concern about organizations being penalized if they aren't able to comply in a timely manner. The organization could do everything possible to protect itself, but the threat's still there, and they can still become victims of an attack, even if they've kind of done everything right. The comment period is closed now. CISA will have 18 months to issue a final rule, taking into account not just comments from the healthcare industry, but other sectors that would be impacted by the rules. So we'll just kind of have to wait and see.
Yeah, but I do think, one huge takeaway from this is, given all the legal ramifications, this is why it's so important that the first people you contact after you discover a breach is your lawyer, because they will help you through this. And
the HIPAA Journal from July 24th referenced an IBM article that gives more information on this. Healthcare data breaches are more costly than any other industry, with an average cost of almost $11 million. Organizations with fewer than 500 employees average just over $3 million. The most common causes of data breaches were phishing attacks and compromised credentials. The average time to detect a breach is 204 days, and to contain it averaged about 73 days. About one-third of data breaches were found by the breached entity. 40% were identified by a third party, such as law enforcement or a security researcher, and the attacker actually notified the victim in 27% of the breaches. And the breaches that were disclosed by the attacker lasted almost 80 days longer on average than the ones found by the victim. So you want to make sure that you're keeping an eye out for these things, because obviously the less time they spend, kind of lurking in your system, the better.
And the less amount of data that they probably
Absolutely.
can get access to.
IBM Security found that paying the ransom only resulted in a small savings of around 2.2%, and noted that law enforcement recommends not paying the ransom. Of course, all businesses are going to have to decide how to deal with any issues using their own resources. So, like John said, talk to your lawyer, talk to law enforcement, figure out, what to do.
And take security seriously. We've talked about how so often when I walk into a surgery center, it's easy to figure out what the passwords are because people post it on their screen or underneath their mouse pad or something like that. And, as well as making sure you have secure passwords and change those passwords on a regular basis.
So I found an interesting editorial article in the HIPAA Journal from July 17th, 2024 that talked about cyber fire drills. In the article, Josh Ablett brought up the importance of what they termed cyber fire drills. Everyone has heard about the increase in cyber attacks in healthcare, and most are focusing on prevention, putting all those, like what John talked about, the passwords and having good firewalls put up. But this is an important piece of keeping your facility safe, because it's clearly doing all those things is not foolproof and can't guarantee that you won't be the victim of a cyber attack. So Mr. Ablett pointed out the incredible disruptions that follow a cyber attack and all the decisions that must be made, pretty quickly. And, do we pay the ransom? Who do we call for help? Do we engage the FBI? What exactly do we have to tell our patients? Who's going to notify them? All of those questions. He also compared discovering an attack to diagnosing an illness. The longer the hackers are able to stay in your system, as I said, the more harm they're going to do. It's important to train your staff to recognize the signs of possible issues. And some way they've seen breaches discovered could easily be ignored, or, you might not even realize it. Like one way was an out-of-office reply for an email the employee didn't remember sending. An employee's mouse started moving in unexpected ways. I would probably think it was the battery,
Right.
But then if you replace it and there's still something. Someone's sent folder was suddenly empty. These were all things that indicated a breach that people probably wouldn't think of. So it's just really important to train for that, to run through these things and talk it through, what is going to be your first step, so that when it happens, you're not all scrambling and trying to make these decisions. Have those numbers of whoever you're going to call, handy, and try to make some of those decisions ahead of time.
Yeah, and I think another important point, the numbers, that the dollar amount for curing these problems is astronomical, and it really does point out the importance of having cybersecurity insurance. So hopefully everybody has discussed this with their insurance broker, but if you haven't, it certainly is time to do that now. And then Becker's ASC Review, our friends over at Becker's, had an article about ASC leadership pay. And I understand, according to the article, it's soaring, isn't it, Sue?
What they said, Becker's was referring to a report in OR Manager that noted that ASC leaders, such as administrators and nurse managers, are experiencing a growth in pay, with more than 3/4 of the leaders earning in the six figures. And a survey of 139 ASC leaders in 2023, primarily from physician-owned or joint venture surgery centers, 77% of the leaders said they made $100,000 or more, which is up from 58% just the year before. And the respondents were supervising an average of 40 full-time employees, just to give you an idea of the size.
I think it's important to note, too, that we certainly know that the salaries of ASC leaders varies dramatically depending on what part of the country you're in. Some of the major metropolitan, especially the East Coast and West Coast areas tend to have much larger, much higher salaries than that was,
which
than
they
what
should,
was quoted.
Based on, cost of living in different areas.
Right. So let's talk a little bit about some of our recent experiences. Policies and procedures has been one of those areas that it's always an issue in a surgery center. But we had recently visited an organization that had a policy manual that was basically a copy and paste from the conditions for coverage. And to a certain extent, the interpretive guidelines and accreditation standards. There really was no meat in it, Sue. And I remember talking to the administrator there, and the administrators, pointed out that, well, these policies and procedures have passed every survey for the last 20 years. But what I noted to that administrator is that the policies and procedures were really not very helpful to the employees. As a matter of fact, most of the employees really hadn't read them, or if they did read them, they didn't find much useful information in there. A good policy manual is going to provide guidance to your staff rather than to rehash the regulations. I've said this before, and I think it's true that the policy and procedure manual is really your instructions for use for your surgery center. It's the way for the governing body to provide you and your staff with guidance as to what their expectations are for running your surgery center. And that does bring up another point. Don't keep the regulations and the accreditation standards secret. We do have a conference that we did in November of 2023 called the Conditions for Coverage and Interpretive Guidelines Conference. And that it was recorded, and it's available on ASC-Central.com, and it's available for free if you're a patron member. But it's a good conference. It's a full day, 8-hour conference, but it's a good way to kind of get your staff to know what the regulatory environment is for your surgery center. And again, we talk about how a survey is really an open book test, right? So, you have all that information. You even know what a surveyor is going to be asking you, if it's an accreditation survey or a state survey or a CMS survey. You know those questions by reading the accreditation manuals, by reading the interpretive guidelines and the conditions for coverage. So make sure your policies and procedures really do match up, but they don't just rehash what's in the interpretive guidelines and your accreditation standards. We haven't talked about billing and collection for a while in the ASC, and we decided to check in with our friends over at SIS for a discussion about revenue cycle metrics. I also did want to point out that Christina Benton and I are working on a revenue cycle conference that's going to be in November. I haven't announced it yet, and we don't have any more information, but it will be in November. Let's take a short break now, and then when we come back, we'll discuss the revenue cycle with Jessica Nelson from Surgical Information Systems.
Surgical Information Systems is a proud sponsor of the ASC Podcast with John Goehle. Our award-winning software platform, SIS Complete, is the choice of over 1,000 ASCs. Why do so many surgery centers operate smart with SIS solutions and services? Because modern cloud-based software with modules for inventory, scheduling, revenue cycle management, clinical documentation, patient communications, and analytics, all on one platform, streamlines workflows and delivers data, including detailed case costing, that helps centers run smoothly and stay focused on what matters most: patient care. Efficient, comprehensive, easy to use. That's smart. And it's all backed by an industry leader who has focused on surgical software for over 28 years. To learn how Surgical Information Systems ASC software or revenue cycle services team can help, call us at 800-866-0656 or visit us online at sisfirst.com.
So I'm here with our friend Jessica Nelson with Surgical Information Systems. Welcome, Jessica.
Thank you for having me.
Sure. So why don't you introduce yourself to our audience?
Sure. So my name is Jessica Nelson. I'm Vice President of Revenue Cycle Services here at Surgical Information Systems. As Vice President of Revenue Cycle Services, I oversee our team that delivers our coding, billing, collection, AR services to the ambulatory surgery centers that are seeking partners with their revenue cycle management.
Jessica has joined us previously for previous podcasts, and of course, we're always grateful for the input we get from our longest or second longest sponsor, SIS. So welcome again. Jessica, tell me a little bit about what's going on in the AR collections marketplace right now. You know, what is you and I haven't talked for over a year, and just kind of curious as to what the state of collections is right now.
Yeah, it's been really busy for us. I think ambulatory surgery centers just all over the country as they're looking to either build a new ASC or they're looking to expand. One of the biggest things that we hear from our surgery centers or, the surgery centers out there is just challenging with finding the people to run the business office operations. And, obviously that gives us the opportunity to talk to them, but more importantly, us having the resources and the knowledge to help them get off the ground, whether it's a new surgery center or it's a surgery center looking to expand or, even fill any gaps with their business office operations they have in-house.
It brings up an interesting point. For years, our surgery centers have suffered with problems of being able to identify nurses, for example. But now we're finding, staffing challenges are across the board in surgery centers.
Oh, yeah.
Why do you think it is that surgery centers are having problems recruiting or finding people to work in their business office on, billing, coding, collections, et cetera?
That's a good question. One of the things that I think may be contributing to it is, more and more of the workforce is seeking opportunities to work remotely. And with a surgery center, right, there's normally a business office for them to come into. And, it may provide or prove to be challenging for the surgery center to find people to come into the office.
So perhaps one way to find people is to be a little bit more open about where they might work from, being able to work remotely if that's an option they might have.
Yeah, absolutely.
There's been a lot of changes in billing recently. Medicare, of course, has expanded the types of cases. We're getting into cardiology. Do you think that also has a bit of an impact with regard to the experience of the individuals that you want to hire into a surgery center environment?
Yeah, that's a really, really good point. As surgery centers are getting into the cardiology space, there is a very specialized type of knowledge for the types of procedures that are going into the surgery center for cardiology, and finding revenue cycle team members or business office team members that just have ASC knowledge is challenging, but to find them with specialty specific knowledge is even more challenging. Yeah,
I think also, with the expansion of the types of procedures that we're seeing occurring in orthopedics and surgery centers, I think that those prove to be very difficult coding challenges too, I would imagine, and a lot of follow-up usually with the insurance companies and trying to get the collections.
Denials,
Have you had a chance to see, where we are with regard to a number of days in receivables? Is that something that's been increasing, decreasing? Do you have any feel for that?
With Medicare being still a pretty prominent payer in the ambulatory surgery center market, it's still staying just on average around that 32 to 35 mark. Yeah. However, those surgery centers that are bringing in some of those orthopedic cases, more work comp, more commercial carriers, that's probably the payer mix that we're seeing it taking longer for the carriers to pay initially and or pay through an appeals or follow-up process. Probably for the commercial work comp, it's getting closer to that 45 range.
Well, that brings us to the next real big question is, what types of metrics should our administrators and business office people, as well as the governing body, be looking for and watching for in their surgery center to be able to monitor the status of their accounts receivable?
Yeah, good question. So AR is probably the bigger driver in any type of metrics. Some important numbers to look at there are your AR percentages. Obviously, AR over 90 is one of the more common ones that we hear in the industry. However, it tends to be more of the reactive metric. If you see your AR over 90 climbing, then there's a problem with your under 90 bucket. So monitoring your AR over 90 in addition to what's in the 0 to 30, 31 to 60, 61 to 90 buckets. But even more proactive than that, I would highly recommend looking at your days to bill, as that's an indicator of aged accounts. If it's taking you longer to get bills out the door, then that just adds on to the number of days that the payer is going to take and the AR is going to age. Also, I would recommend days in AR, which we talked about. Days in AR really is an indicator to help you realize where payers may be delaying or spending more time to process your claims. And then some other ones that just help with some resolution or identifying where there's opportunities. I would recommend looking at your clean claim rate and your denial rate with your claims through your clearinghouse. So clean claim rate being any of those rejections up front prior to the payer processing the claim. And then your denial rate, seeing if you're having any spikes with certain types of denials or payers that may be denying for new reasons or even common reasons that you just got to make sure you've got good processes in place.
So for the average administrator, and again, many of our audience members, to be honest with you, are probably, directors of nursing who might have only a little bit of exposure to the finances, or administrators who often rely upon, their business office to watch over these numbers. How do they get this information, and how do they follow up? What should they be expecting their staff to be gathering for them?
Many of your ASC software platforms have some built-in reports that will provide you insight into those metrics. Additionally, if you're using a clearinghouse, the clearinghouse can provide insight into the two metrics that I had mentioned at the end, the denial rate and the clean claim rate. But at minimum, I would expect your business office or revenue cycle management teams to provide the data for you to see on a monthly basis. However, if you want to be even more proactive, having access to the reports, whether it's through your ASC software platform or the clearinghouse, you can run those on a weekly basis as well.
Yeah, and you bring up a very good point, too, is just for an administrator to have access to those. I remember that, when I was an administrator in the trenches there, I would have access to the clearinghouse logins. I wouldn't look at it all the time, but when I saw AR inching up, then I would start to look at those things. But I probably could have been a little bit more proactive if I had looked at it more frequently, or if I had insisted upon that, that reports to be sent to me by my business office. I mean, we, truthfully didn't really have a lot of AR problems, but I'm talking 17 years ago or more than when I was in the trenches. But I think it is important that you know how to access that data, know what to request from your billing, staff, and know when it's time to start intervening and getting some additional help.
I would definitely lean on the team to provide the data to you, lean on your business office team or your revenue cycle team to provide the data to you versus a director of nursing or an administrator running all of the data, because the users that are in the system are probably more familiar with how to get the information and report it to you, and also can provide you some context and some insight into the numbers and why they are where they're at today.
But it is important that our administrators and business office managers know what those numbers mean. And sometimes getting it from the vendor that's in themselves, would be helpful too. No, I agree with you. Yeah, well, and of course, just asking those questions of your staff will help you to know whether they really are following up on things and totally understand what those numbers mean. Something that's not watched is probably not being carefully considered. And I think people can get lax after a certain time. You bring up an interesting topic about software. This is one of my pet peeves in the industry, and I know you and I have talked about this in the past. And that is, when we walk into surgery centers, we sometimes see that they're, the doctors have ported their software from their office over to the surgery center and think that software that they're using in their office will do a good job of billing their ASC cases. I think I know what your answer is going to be about that. But what do you think about non-ASC specific software, without talking about your own system, but just talking about the pitfalls of not using something that's been designed for an ASC?
Yeah, I've been fortunate enough in my career to not have to use a non-ASC product. However, we do work with surgery centers that are onboarding with our services that may be coming from a non-ASC platform. And just the transparency and the integration capabilities, I have seen to be, the bigger challenges that the surgery centers run into, knowing what reports that they can run for daily reconciliation or those monthly reports, or just knowing where your claims are at in the process, and the integration with other products that are out there that, really can supplement a good business office operation as well. Yeah. From communication tools to analytics to other products like that.
Yeah, actually, I want to go back to something you mentioned earlier, talking about the days to bill, because that's one of those often quick fixes that you have out there. One of the first things that perhaps the administrator can really help on is making sure that, that the physicians get their operative reports in on time, hopefully simultaneously with the end of the procedure, putting whatever resources that they can get into making it easier for the doctors to get those documents in. And of course, having an electronic medical record system.
Yeah, and if you're not leveraging the EMR system within, the practice management software that you're using today for the surgery center, that's where integration can come into play and really help speed up that process, getting the operative notes to come in, be presented right to the coders. So that they can take it from there and move that case through the process to be billed.
So if I'm an administrator, we talked about some of the metrics like the AR over 90 days, the days in receivables. We make the presumption, hopefully, or let's just state that you should be tracking and trending that by month at the very least, more frequently if you're already in a troubled period, if you're starting to have problems. But where do you think people should start worrying on those two metrics in particular?
As soon as you see them either not meeting an internal benchmark or target that you've set, or they're going in a negative direction. So, there's plenty of surgery centers that we work with out there that, we might be maintaining a metric month over month over month. And then all of a sudden 1 month, it spikes or, something declines that, shouldn't be declining. So the monthly is at minimum. However, if you've got a little less time, even a quarterly look back, just to set some new metrics or targets as you're going into the next quarter, or even, the second half of the year as we're already in for 2024.
So if I'm an administrator and I see that my number of days or my AR over 90 days is getting high, what should I be doing with the people that are doing the follow-up in my business office on that? What's a quick way or a effective way for them to interface with them when you see things going in the wrong direction?
I would recommend setting up a meeting with them, on a weekly basis, talk about some of the updates as it relates to the payers that may be inflating that over 90 AR. But more importantly, talk about some of the plans or the action items that your revenue cycle or collections team has put into place. How is that contributing either to what you may see as reductions week over week, or if it's not reducing, what new plans or new action items do you need to track or discuss as you go into that next weekly meeting?
Yeah, one of the things that I always want to do when I'm sitting down with them is, kind of go account by account through those start with those big dollar amounts and go down from there, and just to make sure that they're doing something and document it in that software. That's so effective and so important, is making sure that there's real good documentation in there for that follow-up. And, of course, running those aged account receivable reports so that you know which accounts are problematic. That's what I used to do, is I'd have access to my billing software. Obviously, I'd go in and look at the big dollar amounts. And even before I sat down with them, I would be saying, hey, wait a minute, I don't see any activity here. It gave me a good conversation starter when I was sitting down with them. But, we should be expecting, when you're dealing with things that are over 90 days, you don't want to wait to the end of the month to follow up on it. You should probably be doing, weekly, follow up on those big ticket items.
Yeah, that's a good idea. I know some of our teams do some top 10 AR discussions on a weekly basis. Let's just look at the top 10 accounts.
Or use the 80/20 rule.
Yep, those are typically your higher dollar ones, or maybe a payer specifically that's causing some concern with the AR.
So ultimately, I think we're all challenged right now with. We talked about finding staff. We're challenged with so many other issues that are causing problems. Rapid growth sometimes. Because there's a lot of people are moving into more intensive orthopedic procedures, which take more, staff time. Administrators and directors of nursing, first of all, they're hard to find right now. Finding people that are really experienced are even harder to find. So, I'm sure out in our audience right now, they're listening to you and saying, wait a minute, I don't know how to do this. I don't have the staff to be able to oversee this. I can't find anybody in the community. The nurses want to all work remotely, which is not going to work. Yeah, I'm kidding, of course. But, but you're right. You mentioned it earlier. People want to work from home now. And if we are, we have to start considering whether that's an option that we have to, to look into. In our billing staff or other business office staff, accounting functions even can often be pulled off site. So that brings the question ultimately up: at what point do you just say, "I'm done. I can't do this billing in house. I can't do it myself." How should organizations approach that? What types of things should they be considering when they're contemplating totally outsourcing? Perhaps coding and billing.
I would say, if you're setting up those weekly meetings, you're looking at your numbers month over month, and, despite all of the hard work and the efforts that, either the team that you have on staff is putting forth, or, you're faced with, okay, we're discussing this and realizing we need additional team members to add on to the team. I think it's kind of those two opportunities that would make me, if I were administrator or director of nursing, think about, okay, how can I leverage an outsourced partner to help me in turning these metrics into, the direction that we all want them to be. And that doesn't necessarily mean that you've got to get rid of your business office team that you have as part of your surgery center. There's typically some type of liaison that's necessary when you work with an outsourced partner to be able to, share documentation and or, get coordinated or facilitate conversations with the physicians as necessary through the process as well.
Yeah. We talked about this before, but once you've decided to outsource, talk a little bit about what your expectation should be for information like metrics. I'm sure the same metrics we talked about that you should be looking internally should be the case. But how do you get that information? When should you react, and how do you interface with that vendor at the higher level? We know that the day-to-day activities might be with business office staff, but if as an administrator or director of nursing who unfortunately has been given that responsibility, what should they expect from that outsourced vendor? Exactly
what we talked about with what you would expect from your internal teams. At minimum, talking about the metrics, that the goals and where you are in comparison to those goals, at least on a monthly basis. We work with our surgery centers weekly or biweekly throughout the month to report out on where the numbers are at, but also do offer a call as well if there's any items that we need to, take action on or collaborate on week over week. But I would, at minimum, expect some type of monthly report summary and package to be provided from a revenue cycle management partner. Yeah, and I think it goes without saying that this is an industry where you really have to get people involved. If you're going to outsource AR, you got to get you have to outsource it to organizations that know the ASC industry. There's a lot of vendors out there, and of course, I'd be very hesitant about doing it to about outsourcing to smaller firms, and not just because SIS is a sponsor, but just because you want to make sure that those people are going to be there tomorrow and the next day, and of course, get all of this in writing, before you do the outsourcing. That what reports you're going to get, the frequency that you're going to get them, and then follow up if you don't get that information on a regular basis. Yeah, many of your contracts should include the frequency as well as, the mutual goals that you and your revenue cycle management partner are going to be working towards together for your surgery center. And you don't want to get lax about this. It's easy, when everything's going well, to kind of forget that those reports, you look at reports for 6 months and there's no problems, and then you kind of forget to look at those reports, and then something starts to creep up, and before you know it, you got a problem. So never let go. Always have those metrics, and report them to your governing body too. That'll get them involved in it, because trust me, they want to know just as much as you should want to know when you start to have a problem. Absolutely. Jessica, as always, it's a pleasure to have you on. I appreciate your information, and we'll put your contact information if people want more information about SIS and the wonderful team you have over there. But thank you very much. Thank you. Have a good day. Thanks.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff, and other events in the ASC industry.
The 2024 Illinois Association of Ambulatory Surgery Centers annual meeting will be held August 22nd through the 23rd, 2024 at the Crowne Plaza Chicago O'Hare Hotel in Rosemont, Illinois. And I'm going to be doing, as I mentioned earlier, the ASC Administrators Workshop, which is a 4-hour workshop for all of those administrators who just want to brush up or learn more about how to be an administrator.
The California Ambulatory Surgery Association's annual conference is September 4th through the 6th in Anaheim, California at the Anaheim Marriott.
The Tennessee Ambulatory Surgery Center Association's annual conference is September 12th through the 13th, 2024 in Chattanooga, Tennessee at the Chattanoogan.
And the New York State Association of Ambulatory Surgery Centers annual conference is September 17th through the 18th at the Desmond Hotel in Albany, New York. AHS will be doing the pre-conference, which is 3 hours of education, on Monday the 16th.
And don't forget about ASC-Central's Infection Control 101 conference, which is going to be September 26, 2024. It's a virtual conference. And Infection Control 201 conference is the next day on Friday, September 27th. We've been doing these valuable training programs since 2020, and the programs serve several purposes. They provide training for your infection control coordinators to meet the CMS conditions for coverage and accreditation standards for infection control training. They also provide ongoing training, which is also required of coordinators. And it also helps prepare your coordinators for CAPE or CAIP certification if that's something that they are interested in. For more information, visit ASC-Central.com.
And the Atlantic States Conference, sponsored by the Virginia and North Carolina ASC Associations, is October 10th and 11th at the Embassy Suites by Hilton, Raleigh-Durham Research Triangle in Cary, North Carolina.
And our ASC Central Virtual Director of Nursing Bootcamp is going to be October 22nd through the 25th, 2024. For more information, also visit ASC-Central.com. And keep in mind that the virtual component or the 4-day conference is only part of the training that you get as part of the Director of Nursing Bootcamp.
The Becker's ASC's 30th annual meeting, The Business and Operations of ASCs, is October 30th through November 2nd in Chicago, Illinois at the Hyatt Regency.
The Washington Ambulatory Surgery Association's 2024 Annual Education Conference and Trade Show is going to be November 7th through the 8th, 2024 at the Tulalip Resort and Spa in Tulalip, Washington. And I'll be speaking about accreditation and provide an update on accreditation trends.
And as we mentioned earlier, the 2024 Multi-State Conference is November 14th through the 16th and will be presented virtually. We will provide a link in our show notes for more information.
And don't forget, there's on-demand versions of the ASC Director of Nursing, the ASC Administrators, and the Business Office Managers boot camps. They're all available on our sister website at asc-central.com. And I do want to remind our listeners about our patron program, which is also known as ASC Central. This exclusive membership website is a one-stop shop for all things ASC regulatory and accreditation, compliance, operations, and financial management. It's perfect for busy administrators, nurse managers, and business office managers. With your membership, you get access to regular, usually weekly Zoom sessions where you can connect with other patron members and our podcast team, as well as usually at least 3 surveyors. But that's not all. You can also gain access to a treasure trove of resources, including our virtual conferences like Credentialing Conference, the Conditions for Coverage Conference, and more. Plus, we also provide example policies and procedures, sample forms, and our renowned fire and disaster drill kits. Your membership also helps keep the podcast running smoothly by covering costs like research, travel, equipment, and production. For more details, just visit asc-central.com. Thank you for joining us for this episode of the ASC Podcast with John Goehle. If you found this information informative, we encourage you to share it with your friends and colleagues in the ASC industry. And don't forget to hit that subscribe button so you never miss an episode. We would love any feedback about our episode or ideas for future episodes by sending us an email at comments@ascpodcast.com.
We'd like to give a special thank you to our great team here who make this podcast possible. Our sound editor, Susan Cronkite, our executive producer, John Goehle, and our dedicated research team, Sue Cronkite, Jenna Alvarez, Judy D'Ambrosio, Mike D'Ambrosio, Alex Borneman, Zach Kelleritis, Jim Masters, Amy Cronkite, Lori Rodricks, Kathy Foti, Donna Macchio, and Christina Norman. We couldn't do it without them.
Our music is provided by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast platforms. Thanks for listening.
This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, SIS. SIS's mission is to deliver solutions and services that help surgery providers, regardless of care setting, improve their organization so they can deliver the highest level of care to their patients. For more information, go to sisfirst.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.